While talking about the growth plate is a highly organized structure which consists of multiple layers. The first layer is reserve zone, the second layer is proliferative zone, the third layer is hypertrophic zone, and fourth layer is metaphysis. Regarding the reserve zone, these are having a minimal amount of cells itself. These chondrocytes are surrounded by a dense extracellular matrix. There is more extracellular matrix than cell itself, and the chondrocytes are not aligned. As the name depicts, the reserve zone is an area where there is a storage of lipid glycogen and proteoglycans. Then comes the proliferative zone. As the name indicates, the chondrocytes proliferate over here and are placed in like columns, and they are flat chondrocytes. There is increased amount of oxygen tension over here, which inhibits calcification. Then is the hypertrophic zone. The hypertrophic zone is a zone where the chondrocytes hypertrophy while they are in columns. These have a high mitotic activity, and there are multiple parts of hypertrophic zone. That is zone of maturation, zone of provisional calcification, and degeneration zone. And then is the primary spongiosa and secondary spongiosa, where there is a vascular invasion happening. The primary spongiosa is the area where the corner fracture happens, while the secondary spongiosa is closest to the metaphysis. Moreover, there are two more things to remember. One is growth groove of Ranvier, which is the wedge of chondrocytes, which gives the width to the epiphysis itself, and gives from periphery chondrocyte supply. The perichondral ring of Lacroix is basically a dense fibrous tissue which reinforces the physis on the metaphysis, and this provides strength and resists compression, tension, and shear forces which can happen at the level of physis itself. Regarding problems which can happen if the pathologies which can happen in the epiphysis, they can be spondyloepiphyseal dysplasia, multiple epiphyseal dysplasia, or chondrodysplasias. In the reserve zone, the problems which can happen is pseudoachondroplasia, nice dysplasia, dystrophic dysplasia. In the proliferative zone, there is gigantism, achondroplasia, and hypochondroplasia. In the hypertrophic zone, there is the problems can be mucopolysaccharidosis, rickets, slip capital femoral epiphysis, and physeal fractures. Primary spongiosa is the area where osteomyelitis can happen, and the secondary spongiosa is a place where osteopetrosis, osteogenesis imperfecta, and scurvy can happen.